All right, so welcome everybody. Oh, somebody else here.
Yeah.
All right. We got two more chairs right here. Oh, you're last, so you got to sit up front. there's one more over there if you want to sit in the end on the side there. Yeah.
Now you gotta sign in, but it's already going that way, so.
We'll catch you later.
He knows me well.
I know you well. It was actually more than we anticipated. Good. Well, welcome.
That's awesome.
My name is Dr. Carlson, Steve Carlson. If I don't know all of you, know most of you, but welcome to our office here. This is a chiropractic, Chinese medicine, functional medicine, whatever we need to do to get you well office. And we incorporate, obviously, the Chinese medicine, the acupuncture, herbs, chiropractic care from a lot of different directions of chiropractic care. It's not just about adjusting spines, it's about digging deeper than that. Obviously, the supplementation we have, decompression tables, we have beamer therapy, oxygen therapy. So, again, whatever we need to do to get you there, and we'll try to uncover any kind of condition we can to get down to the root of it and help you improve your health. So that's kind of what we do here. I've been doing this for 37 years now. Graduated in '89. Practiced for 7 years after going to Palmer in Davenport. Decided Chinese medicine is something I want to dig deeper into. I started acupuncture just a couple years after I graduated from Palmer, more certification work. I wanted more than that, so I left my practice, went back to school for Chinese medicine for another 4 years down in Santa Fe, New Mexico. China came to me. I didn't have to go to it, so it was nice because we didn't have to travel abroad, but it was a great education there. Finished there in '99. Started practice went to Eureka just for a short period of time, then to Sterling for 14 years. And then I moved the practice over here because we lived here, and since 2014, I guess it's been, so 20 or 12 anywhere. My math is off. 12 years since being here. So it's obviously a good move, and been a great facility here and helping people. But we're going to talk about cholesterol tonight. Sticky situation on that one. A lot of misinformation from what I'm seeing in the medical journal. So I'm going to do my very best to give you information, not just from my opinion, but as much as I possibly can tonight from the medical journals, from research. So I'm trying to stay out of opinions as best I can. I have to make this abundantly clear, though. None of you here or listening should ever stop your medication just because of what I'm saying. Prescription medications are outside of the scope of practice for chiropractors to give you advice on. Taking your prescriptions are strictly between yourselves and your medical doctor. So I don't want any of you stopping your medications just because you assume that I told you so. And I'm not going there. So if you have questions, I hope I'm going to stimulate some questions in your mind as far as why cholesterol medications. Why am I taking this? Is it beneficial? Is it good for me? Is it bad for me? Should I continue? Should I not continue? I want you to take all these questions to your medical doctor and discuss them with he or she. So please do not stop your medications just because of what I'm saying tonight. I want to make that abundantly clear. That's not my job here. So I'm going to give you information to hopefully start some questions and learn more about what cholesterol is all about and what these statin medications do or don't do. So hopefully alleviating or answering some questions there in your mind as far as what you're doing. So what is cholesterol? And forgive me, so I'm going to be reading a lot because there's a lot of information. I got to try to keep it down to an hour as best I possibly can. We can probably be here for hours on this subject, so I'm going to try to get through as best I can, as much information as I can. So I'm going to be reading somewhat. I'm going to be talking a lot the rest of the time. So it's a white crystalline substance. That's the formulation. That's the formula for it. Found in animal tissue and various foods that is normally synthesized by the liver and is important as a building block of cell membranes and a precursor to steroid hormones. How much cholesterol that's circulating through your body does your liver make? 80%. The rest of it comes from food. There was a study done, I may be getting ahead of myself, but there was a study done that they fed subjects cholesterol-rich substances, foods and such. an enormous amount, more than you'll ever get in any kind of daily intake. They found that the liver stopped its production of cholesterol. If you don't eat as much cholesterol through your diet, your liver is just going to produce more. Because there's a set point. We call it, your body has control over that and everything else. We call it innate intelligence. Our bodies know what it's doing and why. So if it needs higher cholesterol, it's going to do that on purpose. Stress alone can elevate cholesterol in a heartbeat pretty quick. So it's going to keep that same set point wherever it is. And it shouldn't be our jobs as physicians to come along and try to second guess the human body and what it's trying to do. And pretty much all the hormones in the body are made from, especially stress hormones, made from cholesterol. It's a building material. So the types of cholesterol are the LDL, the low density lipoproteins, high density HDLs, the very low density, triglycerides, which is another type of lipid. Those are the types of cholesterol that circulates through our system. LDL has a bad rap. It's called the bad cholesterol. HDL is a good cholesterol. LDLs basically take it from storage and puts it in the bloodstream, and the body's got to use it. So it's putting it into the bloodstream. And that is a common misconception, is just simply because cholesterol is circulating into the arteries, it must be plaquing then. So the idea is, let's drop that cholesterol and as much as we possibly can so it's not present in the arteries to plaque. That's way too simplistic. That's not how it works. HDL takes it from the bloodstream and basically puts it in the storage. And I'm keeping this very basic, but that's basically what it does. So that's called the good cholesterol because it's taking it out of the bloodstream. Misrepresentation. It's much deeper than that. Lipoproteins, the function of lipoprotein particles is to transport fats and cholesterol around the body in aqueous blood, in the blood, throughout the blood, in which they would not normally dissolve. All cells use and rely on fats, and for all animal cells, cholesterol as building blocks to create the multiple membranes which cells use to both control internal water content, internal water-soluble elements, and to organize their internal structure and protein enzymatic systems. Does cholesterol molecules have a lot of work to do? Absolutely. We're not going to go into the details of all that, but it's everywhere. Your brain is made of 70% cholesterol. Surrounding every cell is a lipid bilayer, two-layer fatty acids that make that cell membrane. I mean, it's everywhere in our bodies. We need fats. We need fats for proper function at a cellular level. If your cells are healthy, all of them, you don't have a chance other than be healthy. If your cells aren't healthy, yeah, you're going to be suffering. So let's keep those cells healthier. Low-density lipoproteins, also referred to LDL, is known as a bad cholesterol. They're produced in the liver and produced by the liver and carry cholesterol and other lipids from the liver to different areas of the body, like muscle tissue, organs, and the heart. LDL are calculated by, doesn't matter, calculations. LDL, here's used to be the guidelines. You were talking about that earlier. LDL less than 100, considered optimal. LDL 129, considered near or above optimal, still acceptable. LDL 130 to 159, now it's considered borderline high. Not anymore. If you're over 100, kind of flipping out a little bit. And it's certainly, 190, okay, considered very high. Okay, that's very high, but again, why? Why would the body want LDLs at 190? For a reason. We can't always answer those questions, unfortunately, what the body's trying to do. But I don't think I've ever seen LDL that high. But it's come down. These recommendations are where you should be, have come down way, way, way down. Why? I can speculate. Bad cholesterol. LDL causes heart disease or atherosclerosis? No. And I'm going to show you why. Oxidation leads to inflammation and plaque formation within the arteries, no matter what your cholesterol level is. In fact, the majority of people dying of heart disease have normal LDL cholesterol levels. The reason is because their LDL cholesterol in arteries are oxidized year after year, and plaque develops despite normal LDL cholesterol. levels. So how much good are we really doing by simply lowering the LDL cholesterol with the statin drugs? Statin LDLs are really the focus anymore, much more than the total cholesterol is. When LDLs become sticky, it's because of oxidative stress, basically. And if it becomes sticky, they think they're already sticking to the arteries, they start plaquing, and there you go. So what's causing the plaquing? Is it the messenger, the LDL? Let's look for the cause. All right, what did I just, that last statement I just made? Oxidative stress causes a disruption in the LDL. All right, why are you overly oxidized? It's not the LDL's fault. If you weren't overly oxidized, the LDL shouldn't be a problem. So why are we overly oxidized? What's the number one cause of ill health? Stress, sure. I'm thinking more even basically something we do every single, well, we stress every day, don't we? So don't stress. Your diets. How much processed food do we eat every day? You shouldn't have any. If you can't grow it or kill it, don't eat it. So let's eat foods that you grow, the fresh fruit, vegetables, the animal proteins are fine. I mean, let's stay with a whole food diet. Lots of fruits and vegetables are anti-inflammatory. Guess what that's going to do to the LDL then? If you have less oxidative stress because of the fruits and vegetables, it's going to protect you from it becoming too sticky. HDL is a high-density lipoprotein, also called HDL, is considered the good cholesterol. It's produced by the liver to carry cholesterol and other lipids from tissues and organs back to the liver for recycling, degradation, breakdown. That's according to the National Cholesterol Education Program. Any HDL level above more than 60 is considered high. High is considered very healthy, and it guards against heart disease. The acceptable HDL range is 40 to 60, is what we want to see. Its undesirable level, HDL, is anything below 40. Again, if it's below 40, why? And things like taking fish oil certainly help bring that up. But again, your body has it down there for a reason. And is it because it's low? Is that meaning you're going to start plaquing? And because there's too much cholesterol in the blood, it's not being taken out by the good cholesterol, removed for elimination? That's too simple. Then you got the very low density of lipoproteins. They are lipoproteins that carry cholesterol from the liver to organs and tissues in the body. They are formed by a combination of cholesterol and triglycerides. The very low density lipoproteins are heavier than low density lipoproteins, the LDLs, and are also associated with the atherosclerosis and heart disease. Triglycerides really has more to do with your blood sugar regulation, more than anything. Triglycerides are the chemical form in which most fats exist in food as well as in the body. They're also present in blood plasma and in association with cholesterol form the plasma lipids. Triglycerides in plasma are derived from fats eaten in foods and made in the body from other energy sources like carbohydrates. There's where the blood sugar comes into play. Calories ingested in a meal and not used immediately by tissues are converted to triglycerides and transported to fat cells to be stored. Hormones regulate the release of triglycerides from fat tissues so they meet the body's energy or needs for energy between meals. Energy stores. So, are we overdoing carbs? And I'm going to pick on each one of you tonight and ask you what you had for breakfast this morning. Hopefully you're eating breakfast. Should we talk about the basics already? All right, 3 main meals every day. Breakfast, lunch, supper. Don't skip meals and have a snack in between each. You don't have to eat a lot. In fact, we're taking in too many calories, more calories than we think we do need. So we don't need as much in the main meals, but grazing every couple hours is important. I'm not a fan of, sorry everybody, intermittent fasting. I know there's a lot of great research out there that says, hey, that's working for everybody. People feel better on it. But if your body is under a lot of stress, if your body's not handling that stress response very well, this can create more stress. So if your body's ready for it, I think it could be beneficial. But if it's not ready for it due to the negative effects of stress, don't do it. Eat every 2 hours. You'll be definitely more healthy for it. So where does cholesterol come from? Foods we eat and produced by the liver. So what percent comes from the liver? 80%. Good. And the rest comes from the food we eat. So why is it important? What does the cholesterol do? It's a building material. What does the body build out of the cholesterol? I quiz you again.
Something about cells.
Hormones.
Oh,
It builds hormones out of cholesterol. And it makes up the brain and such, but it builds hormones. So what's happening if we're driving that cholesterol, the total cholesterol down too low? And what's too low? I like an ideal range of like 160, 180. Below 150, never. You should never go below 150 for total. You should never go below 150 of total cholesterol. That's when problems start. You're predisposing yourself to cancer and other fun things. So what happens when your total cholesterol goes too low? Now you can't build hormones as well. So now you're going to need another medication to make up for the lack of testosterone or whatever. So you want to keep it above 150. It's a precursor to vitamin D. How important is vitamin D? And I'll put a plug in just for a second. If you go to Instagram or my Facebook, that I'm doing little short videos. I have one there on vitamin D. It's just 2-minute quick little videos. I did one on vitamin D just a month ago or so. So if you're interested in listening to those little snippets, go into Instagram for Carlson Chiropractic Clinic or our Facebook page. But vitamin D is ridiculously important. Necessary for fat and mineral absorption. Integral substance for all cells in the body. It forms the myelin sheath around the nerves. Myelin sheath is like this plastic covering on this cord. There's wiring in there. That wiring needs to be protected. That myelin sheath for our nerves is that protective coating around our nerves. That's really important. Neuropathy, what's neuropathy? It's a stripping away of that sheath, leaving those nerves exposed. That's not fun. Important for optimal functioning of serotonin receptors. It's important for optimal immune system function. Primary component of the brain and the nervous system. Necessary for the production of all adrenal hormones. We need it. We shouldn't be driving it too low, because then what are we going to do about all those functions that it needs to do? These are going to be suffering. Your immune system is going to suffer. Vitamin D levels will drop. We need all that. So this is a breakdown of how cholesterol starts, turns into pregnenolone, turns into progesterone, androstenedione, estrone, estradiol. There's a testosterone right here. So that's where all those hormones come from, the cholesterol and the breakdown. So is it a good idea to stop up here? Cut that off? No, you're affecting those hormones. Conditions associated with an imbalance in the endocrine system. Endocrine is a hormone system.
So your vitamin D level, where's that should be at?
I like that 60 to 70.
67.
I've never ever seen anybody, I do blood work all the time here. And I test vitamin D a lot with people, and I've never seen it normal or even close to normal unless a person's already taking vitamin D. And no, we don't get enough vitamin D from the sun. Can you? Absolutely yes. But you need at least 15 minutes every day of full body exposure. Not slathering the sunscreen, not covering up big brim hats and staying out of the sun. You're not going to get the conversion just from being outside. Not enough. So I want it 60 to 70 is more of an optimal range there. These are all the problems from if you disrupt that hormone system. What a lot of people don't realize is the fact that cholesterol in the body does not come from food. The body produces cholesterol as it's needed. Scientific studies have conclusively demonstrated that cholesterol from food has no effect whatsoever on the level of blood cholesterol. Cholesterol is such an essential part of our human physiology that the body has very efficient mechanisms to keep blood cholesterol at a certain level. That research, did I talk about that research? Yeah, we did cholesterol. It kept fed people a lot of cholesterol. They found the liver stopped producing it because the body is wanting to keep it at that same set point. You don't eat enough cholesterol, the liver's going to produce more to keep that same set point. Our bodies have that innate intelligence. It's a very important concept. We got to let the body do its job, and it will, given the right circumstances. We got to feed it right. We got to think right. We got to keep moving. You got to hydrate, all that good stuff, and it has a better chance of doing what it's supposed to do. Oh, here's that study. Yeah, volunteers were fed 3-4 grams of cholesterol daily. This is the reference. I'm going to try to put references in as many of these slides as I possibly can. 3 or 4 grams of cholesterol daily, far more than in the world that anybody else is going to get from foods. And the production of cholesterol by the liver was almost completely suppressed. Your liver is going to produce more. It'll produce more to keep up to whatever it needs at that set point level. Yep. What naturally drives cholesterol production is insulin. It's directly relates to that compound reductase enzyme activity in the liver and drives cholesterol production. It raises cholesterol. So what's that? Where's the hint right there now then? What we're getting into. Is cholesterol the problem? The hint's right there. Diabetes, blood sugar regulation. That's the key. Stress and a cortisol shift. Cortisol is a hormone produced by the adrenal gland. It's a stress hormone. Too much stress means too much cortisol. Your body starts kind of falling apart. You don't sleep. Inflammation kicks up. Where are all stress hormones derived from? Cholesterol. 2002 heart protection study, 20,000 adults, randomized into 2 groups, placebo versus Zocor. How much Zocor is used right now? I don't know. We had a pharmacist. No, she's not here tonight. I had a pharmacist coming tonight too. I guess she couldn't make it. I was going to pick her brain with some of this as well. Anybody have other information as far as any of these meds and such? Certainly speak up. Mortality results, placebo group had 85.4% survival. That means that placebo group was a group that was not given, they were given the sugar pill. They weren't given the medication. Survival after 5 years compared to 87.1 in the Zocor group. Absolute mortality rate declined 1.7 between the 2 groups. A 1.7 benefit, 1.7% benefit of taking the medication. Was it worth it? For those 1.7 maybe people that benefited, maybe, but again, is dropping cholesterol really protecting a person though? That's the question. But that result, 1.7, is insignificant in my book. Prosper study, 2002, 5,800 adults. Pravachol versus placebo. 89.5 alive at the end of the study, while the Pravachol, 89.7. 0.2%. So there's a relative percentage or an actual percentage that they'll report on. Relative percentage sounds better. If you have, just as an example, you got 2 groups, 100 people, and you have a medication group here and control group here taking a sugar pill. 1 person from the medication group had a heart attack. 2 people from the placebo group, the sugar pill, had a heart attack. The relative percentage is comparing that 2 to 1. 2 to 1 is a 50% reduction. That's awesome. 50% reduction of heart disease? Absolutely. I think everybody should jump on it. The actual percentage, though, is taking that 100 in consideration with that 100 with the 2, that's 2% and 1%. Compare it, 2 minus 1 is only 1% difference. That's the actual difference, actual percent. So we've got to watch how they're presenting the numbers. Ascot, 19,000 hypertensive patients, placebo versus Lipitor. Mortality 95.9 in the control group, 96.4 in the Lipitor group, 0.465% difference. American Journal of Medicine right there. Risk of lowering cholesterol levels. Many studies show a higher death rate in the elderly who have lowered cholesterol levels. Elderly females who have a cholesterol level below 155 are associated with a 5.2 times higher death rate as compared to women with cholesterol levels of 272. That's from Lancet. These are the medical journals they're from. That's from Lancet. So is it beneficial to take Lipitor? From this study it says, oh, is that Lipitor? That was a previous. Anyways, statins. Is it productive? Is it helpful? Based on those numbers, no. Risk of lowering cholesterol levels. Women of all ages and men over the age of 55 with high cholesterol have decreased mortality. Over 150,000 studied in Australia found that lowered cholesterol levels predict premature death in men of all ages and in women over age of 50. Not a study out there talks about prolonging life with these research articles, the journal articles. At least not what I've seen. Maybe there are out there. If I am, please correct me. But
Does it come down to a money game? I mean, because there's obviously not a big difference.
so if people can't hear, hope people can hear my phone. As far as questions, I'll repeat the questions just in case it isn't picked up. Is it a money game? You decide.
Look at the ads on nightly news.
Constant ads, yeah. Yeah, I'd like to see them get away from so much advertising. I mean, it's just endless.
Can't even buy it.
Right. Anyway, here's the references out of the medical journals right there. So how do the statins work? Starts with these compounds here, but it stops the production right here. Downstream, you get to cholesterol. Downstream, you also go to CoQ10. How good is CoQ10 for us? It's very important, but it blocks that CoQ10 as well. Not a good way to go. Not if you're trying to help protect the heart. CoQ10 is wonderful for the heart. So, importance of CoQ10, cardiovascular disease. It reduces secondary cardio events by over 45%. Sounds better than the statins alone. Reduces the number of cardiac deaths. Cardiac health, congestive heart failure. Raises the epidemic rates. Helps with infertility, macular degeneration, neurodegenerative disorders, brain atrophy, Parkinson's. A lot of good uses for that CoQ10. So that's something we really need to be protecting. Now CoQ10, I think I have a reference to it later, but if I don't, 14 patients in this study using Lipitor, 3 to 6 months, 10 out of the 14 subjects developed abnormalities in the diastole, which is part of the rhythm of the heart. Diastolic dysfunction is a major cause of congestive heart failure. American Journal of Cardiology.
Statins.
So is that, pardon?
Isn't it statins that cause a lot of pain and joints and things like that too?
A side effect to statins is muscle pain.
I'd worked with nurses and stuff.
Yeah.
I worked at the nursing home, and they were complaining, I gotta get off these statins. They were
Yeah.
complaining how much they hurt.
I do hear that a lot. People needing to get off their statin medications because of muscle pains. Yeah, that is a common side effect. But even more profound is stress in that heart. Did you get it?
What was the level on the CoQ10?
If you have not had a prior episode, a heart episode, then 100 milligrams per day is fine. If you have had a prior episode, 300 milligrams per day is recommended. From the same study, 9 out of 10 patients who developed diastolic dysfunction improved with CoQ10. 4 patients completely reversed their diastolic dysfunction. So why isn't it recommended for everybody that's on a statin? there's a study, if I remember correctly, put out by Mayo's. They recommend, Mayo's Clinic recommends everybody that's on a statin take CoQ10. And I definitely would agree. Because as we saw earlier, it's being blocked.
So if you're not on a statin, should you still take CoQ10 supplement?
There's beneficial. There's benefits to it, yeah. What's another good source of CoQ10 other than the pills? Eggs, I think. Eggs are a fair amount of CoQ10 from eggs. Look that up. Yeah, I got supplements on the shelf here, which is awesome for recovering health. But I'm a bigger fan of food first. Got to eat that food. 6 to 8. I'll be easy on you guys. 6 to 8 servings of fruits and vegetables every single day. If you're not doing it, get on it.
How many eggs a week?
How many eggs a week was the question? Why not eggs every day?
Well,
What are we told?
2 eggs a day.
Cholesterol. It's going to increase your cholesterol if you eat too many eggs.
My great grandfather
There's also an anti-cholesterol in eggs.
Yeah.
Scientifically proven.
Okay. And there's an anti-cholesterol substance in eggs that drops cholesterol.
And you can eat as many as you want because it will actually, over time, lower the HDL.
Nice. But we know, though, your body will regulate itself. You eat more eggs, your liver is just going to produce less because it doesn't need to produce as much to keep that same set point.
You're saying 6 to 8 servings of veggies a day. How much is a serving?
Half a cup. And variety. And organic as much as we can. And cross our fingers, it's truly organic. Do your own gardens, then you can control everything. And too bad we didn't live in a climate we can do that year round. Hierarchy. Let's get a little tangent here. I'll try not to do many tangents, but organic fresh, organic frozen, commercial fresh, commercial frozen, canned. In my opinion, that's best to worst. And that organic fresh, even better yet, from your own garden. So, eat up every day. And if you start the breakfast with some fruit or vegetable, and you work it in your diet all day long, it's easy to get 6 to 8 servings every day.
Why was it with the statins they tell you not to eat grapefruit?
I'm not 100% certain on that one. Why not grapefruit with statins? I don't think I can hear you.
And I'm thinking grapefruit's got to be one of the best.
It's awesome,
Yeah.
but something about the medication it interacts with. So I'm not 100% certain on that, but yeah, it's a common suggestion,
I
yes.
thought that was odd.
Yeah. Lipitor reduces the risk of heart attack by 36% in patients with multiple risk factors for heart disease. Now, the research does tend to lean towards, if you've already had an episode, there's actually a little more benefit to taking the statins to help reduce the risk of the second episode. If you've never had an episode, though, no. I'm not buying it with what the journals are telling me. The dramatic 36% figure has an asterisk. You have to read the smaller type. It says that means in a large clinical study, 3% of patients taking the sugar pill or a placebo had a heart attack compared to 2%. That's 36% difference, is it? No, it's 1. So relative percentage to actual percentage. Adverse effects of the statin, brain fog and dementia. Why brain fog? Cholesterol. The cholesterol-rich brain. You affect that cholesterol, your brain function goes down. Over 50% of dry weight of the brain is cholesterol. Adequate cholesterol levels is necessary for optimal brain function. 1,000 subjects, median age of 75, found that higher cholesterol levels at age 65 years and older was an independent predictor of an increased cognitive performance and a higher level of information processing over a 6-year period. Neurobiology of Aging article. You want better brain function? Protect that cholesterol. Adverse effects of statin: cancer. You'll more predisposed to cancer if it drops below that 150 mark. So we want to keep it above 150. All cholesterol drugs, older and newer, have been associated with an increased cancer rates. Breast cancer is shown to increase by 1,500% with statin users. Numerous animal studies also showed increased cancer rates associated with statins. New England Journal of Medicine, 1,500%. So what are the benefits? A slight reduced risk of preventing a non-fatal heart attack, approximately only 1%, based on the statistics. Possibly independent of cholesterol lowering effects. Is it anti-inflammatory then? Because lowering cholesterol, based on the numbers, is not really protecting us. So is it doing something else maybe as an anti-inflammatory effect? I'm not certain on that. I had a discussion with a medical doctor once a long time in the past, and that's what he was kind of speculating. It could be maybe an anti-inflammatory effect. I'm not sure of that.
Excuse me.
Yep.
Did you say statins has an anti-inflammatory effect?
I'm not going to say that. I'm not sure.
I mean,
Yeah.
Is that what
That's the question. That's the question brought up. If lowering cholesterol effects of the statin is not the mechanism that's protecting people from heart attack, is it maybe an anti-inflammatory effect?
It is not an
Yeah, I don't think it is, but I don't want to give you bad information. If I'm not sure, I'll let you know.
took statins for 2 months.
Yeah.
My hands will tell you the difference.
Yeah. Yeah.
They still hurt.
Yeah. Framingham study. After 30 years of follow-up, researchers reported no increased overall mortality with subjects with high cholesterol for those over 50 years old. Falling cholesterol levels found to increase cardiovascular deaths. Again, there's none of these journals have reported on a longer life by taking statins. They report on a decrease in cardiovascular events, decrease in stroke, but a longer life, I'm not seeing it. 14% increased death rate for each digit drop in the cholesterol levels. Risk of side effects and low cholesterol levels. Now, I spent the last 24 hours trying to get some more modern. I mean, the whole presentation I gave you, I put together quite a long time ago. So I was digging for some recent stuff. Now, if you go to pubmed.gov, pubmed.gov, PubMed.gov is a site we can all go to that you can find research. So that's where I found these on PubMed.gov. That's where physicians go to look for research. And I pulled these from that site. After the discovery of antibiotics, statins, the inhibitors of cholesterol synthesis, have been the best-selling prescription drug in the world. Billions. These drugs have well-documented benefits for cardiovascular disease in many groups of patients in moderate and high cardiovascular risk. Does it? U.S. health authorities are currently pushing for anti-cholesterol drugs to be added to public water supply. Statins' in-depth studies have shown that they can actually have a detrimental effect on the health of people without high cholesterol or heart disease. Statins should be prescribed only to those patients with heart disease or who have suffered a condition in the past. Researchers warn that unless a patient has a high risk of heart disease or stroke, statins may cause more harm than good. They're kind of admitting it there already. What if your cholesterol was 201? What I hear, what a lot of patients tell me, what their medical doctors are suggesting, is they get on a statin medication because it's high. They want it down lower. I had a patient come in to me with a total cholesterol of 89, total cholesterol. And he and his medical doctor were thrilled. But what are we learning here from the medical journals, though? Is that better for him? I say no. And so if you have a cholesterol 201, they're going to throw medication at you. No history of heart issues. 201 is not elevated. It's not out of ridiculous, out of control, what's that going to do to you then? Based on this research article, it's going to harm you. Vitamin D supplementation improves fasting insulin levels and HDL cholesterol in infertile men. The objective of this is this work aimed to determine the effects of daily vitamin D and calcium supplementation for 150 days on glucose and lipid homeostasis in infertile men. The result: the men received vitamin D supplement improved their vitamin D status, whereas vitamin D status was aggravated in the placebo group, characterized by high serum parathyroid hormones. Not important. At the end of the trial, men received vitamin D supplementation at a 13% lower fasting serum insulin. Moreover, men in the vitamin D group had a high density lipoprotein cholesterol levels compared with the placebo group. So higher HDL. What do they tell us about that? That's the good cholesterol. If it's higher, you're better protected. So how important is that vitamin D? If we're going to believe in that higher HDL is going to protect us, okay, let's believe in it then. How important is that vitamin D? High-dose vitamin D supplementation has beneficial effects on glucose homeostasis regulation. And again, we've already determined the fact that blood sugar regulation is the key to cholesterol regulation, protecting against heart attack and stroke. Not really the cholesterol. It's the glucose. And that's what the vitamin D is helping here. 1 second. And HDL levels. So what did we learn earlier in this talk? Do the statins do to vitamin D? It blocks the production. It lowers the vitamin D levels. Is that helpful?
How much vitamin D daily?
I recommend in my office 5,000 a day. 5,000 international units per day. The Vitamin D Council I read quite a long time ago, they recommend 2,000 to 4,000. In my clinical experience of doing this for many, many years, 5,000, I've never come across a patient that has had difficulty with vitamin D. It is a fat-soluble vitamin. You have to be careful with it. If you take too much for too long a period of time, it can be damaging. It's hard on the liver. 5,000 a day, I've never seen that. It keeps the level at a nice 60-ish level. What's too long a period? If you're going to take over 5,000 a day, I'd say 5 days. You do that, you elevate over 5,000 a day when it's necessary. Now again, we do a lot of blood tests here, and again, I've never seen anybody's vitamin D levels normal. And for example, let's say they're 30, and 30 to 100 is a normal reference range in the blood. And I see a lot of people in the 30s and the 20s. For that, again, do not take vitamin D at high levels without a doctor's guidance helping you through it. Don't do this on your own just because you think you might be low. Take a high dose of vitamin D. Not advised. So let's figure out what your vitamin D levels are first. And the only way to do that is draw your blood. Where are you? And I'll dose that vitamin D level based on the lab work. So let's say if you're maybe 30. I want to bring that up. So I'll typically put a person on maybe 10,000 a day, and I might do that for 4 to 6 weeks. And then I'm bringing it down to the 5,000 maintenance. But I would never raise anybody's levels of I would never recommend higher than 5,000 a day unless it's unless they're proven deficient. Medical doctors, they'll give you a 1 time a week is a 50,000 international unit pill 1 time a week, and that does bring it up as well. But again, no more than 5,000 unless you're proven low. And it's a fat-soluble vitamin. So it means you have to have the bile from the gallbladder to digest that vitamin D to absorb it. So take it with the biggest meal of the day, the fattest meal. If you take it on an empty stomach, the gallbladder's not releasing the bile, it won't digest that vitamin D fully, and you may not absorb all of it. So you want the biggest meal so you can get as much out of that supplement as you can. Those who without a gallbladder, you're missing out on that vitamin D digestion and absorption. So you should be on bile salts every day. There's a product from Biotics, is Beta Plus is called. They're bile salts, it's basically gallbladder in a bottle. So you take that with a vitamin D, and it's going to help break that vitamin D down so you can absorb it.
What is the effects of lower level then?
A vitamin D?
Yeah, is there like?
That's a whole nother lecture. It's deep. It affects everything. Pretty much everything. It's almost considered a hormone in all the jobs that it does. So you're affecting almost every system of the body of going too low. Yeah.
Now, said something about calcium along with vitamin D. What level is that? Like you take
Calcium in the blood, you mean, or
no?
a
along with the
dosage?
vitamin D.
I don't. They didn't give a. They don't. I don't think they gave dosages on what they.
No, they didn't.
No. I'm not sure what they did for dosages. I can dig into that. There's a journal article right here. We can dig into that. I can look back into it and find those doses. But 5,000 a day of the D. Again, food. Let's get calcium from food. And we get it from milk. Yeah, we can get it from milk, but you can also get it from fruits and vegetables. Just make sure you're not allergic to the milk. That can cause more harm than good. That's another tangent. We're gonna be here all night. You okay with that? The effects of vitamin D and omega-3 fatty acid co-supplementation on glycemic control, glucose control, blood sugar control, and lipid concentrations in patients with gestational diabetes. The study was performed to evaluate the effects of vitamin D and omega-3 fatty acids co-supplementation taken together on glucose, blood sugar metabolism, and lipid concentrations, fat concentrations in gestational diabetes patients. The conclusion: overall, vitamin D and omega-3 fatty acids co-supplementation for 6 weeks among the gestational diabetes patients had beneficial effects on fasting plasma glucose, serum insulin levels, homeostatic model of assessment for insulin resistance, quantitative insulin sensitivity check index, serum triglycerides, and very low density lipoprotein cholesterol levels. Had an improvement in all those factors. So again, how important is that vitamin D in fish oil? We can go on. This is a whole nother lecture on fish oil too. How important are those? Crazy important for all of that we're talking about. So are statin medications 100% necessary? Here's a thought too, though, and this also goes along with proper healthy eating. Can we all afford to? It's getting more and more expensive. And are there people out there that can afford maybe just canned foods? Yeah, unfortunately, yes. And that's a hard way to maintain optimal health. Can people afford taking supplements? Not really. But can insurance companies reimburse them for their statin medications? They don't have to pay much at all? Yeah. So it's a lot easier.
So again, money game.
Yeah, it's a money game. So would it be better, maybe based on this alone, would it be better to have an insurance company reimburse patients for vitamin D and fish oil? How much improvement would they have in their health? That'd be an ideal situation. So let's figure that one out, and let's go to our government and get some change. Let me know if you figure that one out. Insulin, diabetes, and cholesterol metabolism. Cholesterol metabolism is altered in diabetic states. Again, it's not about cholesterol. Cholesterol is the messenger. Don't blame the messenger. Let's fix the cause, the underlying root cause of it, which is blood sugar dysregulation. Insulin exerts beneficial effects on the metabolism of cholesterol binding lipoproteins. Despite insulin having a stimulatory influence on the cholesterol utilization, this hormone tends to increase the LDL cholesterol. I'm sorry, decrease. Thank you. This hormone tends to decrease the LDL cholesterol. In well-controlled diabetic patients, plasma concentrations of cholesterol-binding lipoproteins are generally found within the normal range. These patients exhibit usually a normal sensitivity to insulin in the liver and peripheral tissues, arms and legs. In this case, the very low density of lipoprotein production is generally decreased. The LDL catabolism or breakdown is either increased or normal, and therefore the endogenous cholesterol synthesis remains at a normal level. In poorly controlled or insulin-resistant diabetic patients, which is very common, both the very low density lipoprotein cholesterol production and cholesterol genesis formation are increased, mainly as a consequence of the insulin-resistant state. Higher cholesterol comes from insulin resistance. All these changes are certainly involved in the accelerated development of cardiovascular complications encountered in diabetic patients. Reference right here. Again, it's insulin, it's diabetes, it's the carbs, it's eating that donut for breakfast. I'm looking at eyes. Who's looking away from me right now, averting their eyes? No more donuts. Let's eat protein. How about the eggs in the morning? Let's have fruit in the morning. Let's have a chicken breast in the morning. That doesn't have to be breakfast food. Let's have a quality food. Heart protection study of cholesterol lowering with simvastatin, and I just picked on simvastatin. I just picked a medication that's currently used quite a bit, so I'm picking on that one. All-cause mortality was significantly reduced with deaths in 10,000 allocated simvastatin versus the 1,507 compared to the 1,328 among the 10,000 or so placebo. So we had about 10,000 in each group, and you had a 12.9% decrease with the simvastatin and a, 12.9% incidence of heart event compared to the 14.7 with the placebo, the sugar group. That's a 1.8% difference. 1.8. About all those people. It's 179 people. How about giving those 179 vitamin D and fish oil? Now, if you're 179 people, I feel bad for you. I'm sorry for you. I mean, that's not ideal, and I hope you did well. So is this medication helpful to those 179 people? I hope so. I hope it helped them. The research is showing, all right, what else did it? Because it may not have been the medication. Again, questions. Adding simvastatin to existing treatments safely produces substantial additional benefits for a wide range of high-risk patients, irrespective of their initial cholesterol concentrations. Allocation to 40 milligrams simvastatin daily reduced the rates of myocardial infarction, of stroke, and of revascularization of about 1/4. After making allowance for non-compliance, people didn't do what they're supposed to in the study. Actual use of this regimen would probably, why probably, reduce these rates to about a third. Now that's speculative. They shouldn't have put that in the study. Hence, among the many types of high-risk individual studies, 5 years of simvastatin would prevent 70 to 100 people per 1,000 from suffering at least one of these major vascular events, which means, I'm assuming, they didn't have an event prior to the study. So is it helpful? It depends on where the cholesterol levels are. Maybe they're 201 and causing more harm, or it was a really high cholesterol. But again, we see cholesterol numbers. I got high cholesterol. What should I do? What can I do about it? Naturally or pharmaceutically? So, I mean, people, red yeast right. We'll see the different things that will bring the cholesterol down naturally. But again, why? You're fighting your body. So, is it worthwhile? If it's worthwhile to you, after looking at the research, after hearing what your doctor says, if it's worthwhile to you and you see the benefit, go for it. I'm never going to kick anybody out of my office for doing something that maybe I may not agree with, but go for it. That's your choice. It's your body. You go for it. But if you're starting to question it a little bit, let's maybe have a conversation with your doctor and see if you guys can't come up with maybe a little bit better alternative. But here's the NNT number. What's an NNT number? NNT is number needed to treat. Simvastatin's NNT number is 25 to 50, depending on what they were measuring: stroke, heart disease, atherosclerosis, whatever. There was different effects on those different health conditions. An NNT number is they have to give it to, in this article is 15. They have to give it to 15 people for one person to benefit. What I come across also outside of the study is 25 to 50. 50 people have to have this medication for one person to benefit. And I believe, if my memory serves, Crestor, I think, is 220. Again, I hope I'm not giving people bad information, but I think that's in my brain. Give it to 220 people for one person to benefit. Is it worth it to those 219 people? Could they maybe benefit more from vitamin D, from fixing their blood sugar, from not eating the donuts in the morning? I think so, yes. And it's like combining the vitamin D with the fish oil. Side effects of simvastatin. Common side effects: muscle pain and tenderness, digestive issues, constipation, nausea, diarrhea, abdominal pain, neurological, headaches and dizziness, upper respiratory infections, skin rashes and itching. That's what the medication can cause you. Serious side effects. And I couldn't get my computer to change that start. Anyway. Severe muscle breakdown, sarcopenia. You lose muscle mass. Is that smart? Absolutely not. I gave that answer away. What's the number one predictor of longevity, longer life, and a longer functional life? What should we be following? What metric should we be following? Cholesterol, blood pressure, heart rate, muscle mass, fat mass, BMI. What should we be following to give ourselves the best chance of a longer, more productive life of those metrics? Muscle mass. That's the number one most important factor. So if you want to live a longer, healthier, more productive life, you keep that muscle mass up.
If you lose that muscle mass at some point, or start losing it, is there a way to regain it, I guess is what I want to say, or rebuild it? Exercise. Yeah, okay.
Nobody likes to hear that one.
No,
There was another study in my brain. They went into nursing homes, and they did programs for the residents and found the average increase in muscle mass and strength 200%. So it's never too late. You just got to get busy with it and consistent with it and do something you enjoy. Doing something you don't enjoy, you're never going to stick with. So find some kind of resistance exercises that you can work your whole body, and you can regain that back again. But what this medication is doing is throwing you in the opposite direction. You're losing muscle mass, potentially, as a side effect. It's not going to affect everybody, but that's a potential side effect. Liver dysfunction causing jaundice, severe upper stomach pain, allergic reactions, swelling in the face, throat, tongue, difficulty breathing, rashes, cognitive effects, memory loss, forgetfulness, confusion. We all know why now. Cholesterol. Persistent muscle weakness that continues even after stopping the medication. That's what simvastatin can potentially do to those who are taking it. Does vitamin D do that? Nope. High risk, elderly patients over 65, those with thyroid issues, kidney disease, or individuals of Asian descent. They're at high risk for taking that medication. How many people have kidney disease? A lot of people. Yeah, a lot of people. Drug interactions with certain medications, including niacin, which is a supplement, B vitamin, those other medications, antifungals. Muscle symptoms, management, muscle symptoms often resolved by changing the dose, switching to another statin, or taking it every other day, or stopping. That happens a lot. So some of the facts: 50% of people that have heart attacks and strokes have normal cholesterol. And I knew that to be a journal article. Again, I wish I could find that to actually show you guys what that article. But 50% have normal cholesterol that have heart events. Have normal cholesterol. So is cholesterol a good metric we should be following to assess heart risk and stroke risk based on that? No, we should not be using those numbers. If high total cholesterol equals atherosclerosis, then low total cholesterol must mean no atherosclerosis. That's not the case. People who have low total cholesterol still have atherosclerosis, plaquing. High insulin equals plaquing. Another study, they used dogs for the subjects for this one, but they injected these dogs with insulin and found that plaquing started almost immediately. Insulin is your friend when it's under control. And it's under control when you don't eat donuts. Sorry. Which is worse, total cholesterol or LDL? And now anymore, they're really looking at LDL more than total cholesterol. Because that's potentially, again, what happens to LDL that makes it sticky? You guys remember from earlier? Oxidative stress. Oxidative stress makes it sticky, basically. Elderly people with high LDL live longer. Statistically. The most important outcome, longevity, isn't mentioned in cholesterol trials. They don't talk about extending your life. Lower cholesterol predisposes to cancer. We talked about that. Talked about the 70% of the brain is cholesterol. Plaquing occurs in people with high as well as normal cholesterol levels. All right, so what's causing the plaquing? Stress. High, blood sugar's not under control. The epithelial lining, which is a cell lining in the artery, in the wall of the arteries, arterioles, and such, when that arterial lining is damaged, then plaquing will start. So what causes that damage? Chemicals, for diet, infection possibly even, but damage in that arterial and that artery wall starts to plaquing. Cholesterol will get in there and they'll start plaquing away, trying to pack and try to protect that weakened area. It's trying to protect you. But it's not a good outcome when it plaques too much and completely obstructs that artery. People entering the ER for non-heart-related signs and symptoms had, on average, a higher LDL than heart patients. Higher LDL does not equal plaquing. What I strongly recommend people do, I see many blood chemistries being done, and nobody's measuring inflammation anymore. Nobody's measuring the damage in that arterial wall, the quantitatively. PLA2, LPA. The PLA2, I learned that from a medical doctor I heard lecturing years ago on neurotransmitters. He covered out that PLA2. That's a marker we can see in the blood if there's active damage being done in the arterial wall. So how much damage is being done right now? Run the PLA2. LPA is nice. CRP is more of a generalized inflammation marker. Homocysteine is very important to keep that under control. Like shards of glass running through your arteries if it's too high. Your body makes homocysteine. It's a natural occurring compound. You keep that under control with B vitamins, very basically. But we got to make sure that's in the normal range. Let's truly, in my opinion, assess that person's risk for heart attack and stroke with those values right there, not following cholesterol levels. That will give me more information, in my opinion, than will those cholesterol numbers to what we need to do. If those are normal, even if cholesterol is high, and again, I've had medical doctors tell me this, nope, you're good. If the cholesterol is high and those are a problem, all right, we got work to do. But not just driving cholesterol down to protect you. We got work to do on those inflammation markers. What's causing the inflammation? Let's fix that damage in that arterial wall. And there's means to do that.
Can you do these tests?
Yeah, this just, again, we draw blood here, and it's just a blood test. We can draw blood, and we can send it to the lab. We use LabCorp, and they can run all those values. So holistic ways to treat elevated cholesterol levels. Decide if elevation of cholesterol is a problem first. Is it a problem? Not usually. Figure out the underlying cause of the elevation. Is there hormone imbalance, toxicity, nutrient deficiency, poor diet, inflammation of some kind, something coming from somewhere? And here's some supplements that can actually reduce cholesterol. So if you really are interested in really, we got to get it down. If you still need to get it down, these are some things that can help with that. Niacin is great track record with niacin, dropping those cholesterol levels.
How long does that take?
Good question. I would speculate probably a month, a couple months, 3 months. I'm not sure on that one how long that would take. I'll have to dig into that one for you. No drug has proven to be as effective as niacin. Niacin has low side effects and is very inexpensive. Journal of Internal Medicine, Archives of Internal Medicine. Those are research journal articles stating those facts.
Does people like flush with that? Like,
They can. Niacinamide is a better form to take then. You won't flush with that so easily. Supplements that I carry that can help lower the cholesterol if you really need to. Ultrameal Plus, Tricol, red yeast rice, BCOH greens, niacin. There are effective ways that you can affect that cholesterol level through supplementation.
The last one's horrible.
That's what I was just thinking.
It's getting harder and harder, I tell you what.
So there's
There's hope?
No, I should never said there's no.
She's walking home.
So, are we going to do those 3 things? And if you're not, start slow. Just start with one thing. If you need to improve your diet to affect this whole thing we're talking about tonight, if you need to improve your diet, not even just the cholesterol idea, but again, let's get out of the idea of cholesterol. We need to get rid of those numbers out of our heads. Let's focus on the blood sugar regulation. If you work on that, you work on the insulin, you're going to be better for it. So what can you do for that starting tomorrow? Is your diet ideal? Are you hitting all those fruits and vegetables on a daily basis? Are you eating clean? Are you eating a lot of refined foods, processed foods? Every time, I shouldn't say it. I see that restaurant across the street over here. I won't say who they are, but I kind of cringe when I see it. Let's stay away from those places because they're not ideal. So if you're not eating well, let's start with breakfast tomorrow. What can you do for breakfast? And the rest of the day, don't worry about it. Don't stress yourself over too much of changing too quickly. Let's change though. So start with breakfast, with a good breakfast tomorrow. Saute a bunch of vegetables. I'll do this tomorrow. I'm going to do this tomorrow. So I challenge all of you to do the same thing too. Saute a bunch of vegetables, and I'll put onions and broccoli. I'll put sweet potatoes in there unless you're on the sugar control program in my office, which if you're not, you were interested in that, let's get talking. You talk to me and we'll get to work on that for you. It's a program that helps regain control of blood sugar regulation, which falls between the liver, the pancreas, and the adrenal glands. All I'm going to say about that right now, but anyway, you can't do high glycemic index foods on that one. But anyway, what else will I put in there? Green peppers and garlic, always garlic out of the garden. I'll saute that and I'll put 2 or 3 eggs in there, whip it all up, and there's my breakfast. So I want all you to do the same thing tomorrow. And call me when you do. Even better yet, send me pictures of it. All right. Any questions?
Make sure it's not a picture of your neighbor's plate either.
Yeah. I think she looked at you on that one too.
Sorry.
I fill the Ezekiel tortillas on top of that.
Yes,
Awesome.
you may. Sprouted. He was referring to Ezekiel bread. Ezekiel from Food for Life Company. There's sprouted grain, and so we have the tortillas over here. So you can make a tortilla wrap out of that. Sprouted grains are far healthier for you than the other bread products on the market. They're live enzymes in these foods, much healthier for us. Our bodies thrive on live enzymes, and you're getting a lot more live enzymes from a bread product like that, from fruits and vegetables, than you will from a breakfast bar or over there.
Do you recommend a certain type of cheese? If you eat any cheese at all?
Hard cheeses are okay. Again, I'm just not a huge fan of dairy unless you're proven okay that you're not allergic. Otherwise, cheeses are, not processed certainly.
Right.
A lot of those cheese squares, they're not cheese, I don't think, are they?
No.
Yeah.
I call them fake cheese.
Yeah.
Those pepper cheese.
Oh, that'll get you going. That'll wake you up.
That's good stuff.
Yeah. Any questions at all? Any other? Well, thank you for all for coming. Oh, I'm sorry, 15 minutes late. Fine. Thank you all for coming. I really enjoyed talking to you guys, and we'll put this on either my website or YouTube or something. I'll let you guys know if you want to listen to this again. But I hope you learned something. We're going to keep these lectures up. I'd like to get back to doing them once a month at least, and we'll throw the subjects out there beforehand and let you guys know. And you're all welcome to come back and listen to me gab a little bit more. All right. Thank you.
Thank you. Always
Yep.
informative.
Thank you.
Thank you.